May is Stroke Awareness Month, and that means it's the perfect time to learn the signs and symptoms of stroke and the actions you should take.
Quick treatment is important, and getting care at a comprehensive stroke center can save lives. Dr. Ali Alaraj joins us from UI Health. Thank you so much for being with us, Doctor.
Thank you.
Okay, so let's just get right into the signs. And there's an easy way for us to remember it. It's be fast. Okay, so can we go over each one?
Absolutely. So this is the acronym that was put by the American Heart Association, and they want people to remember what it is, but actually to act on it. So the abbreviation is for be fast, and be fast to act. And the abbreviation is B is for the balance, and E is for the eye, for the vision, and you change the vision. And then you have the face, and you got the arm, and then you have the speech. And the last one is T is for time. Time to act fast. So you add them all together, be fast, recognize the symptoms, and act fast, and call 911 if you suspect you have signs of symptoms of stroke.
So let's say we see the F on this list, the face drooping. What do you suggest? Like immediately call 911. That's what you're doing. Is there anything I should be doing with the person as well?
Yeah, so what people do not recognize is that stroke could be a minor stroke, could be a major stroke, could be a warning sign of a stroke, could be something called transient ischemic attack, meaning that you could have a small stroke, but it could be preceding a very large stroke. So if anyone next to you, your grandmother, your beloved, have any signs or symptoms suggestive of a weakness in the face, arm, leg, speech, vision, or balance, call 911 because this could be the early signs of stroke. And it's very important that we recognize that early on because the treatment depends on how fast we intervene.
Oh, wow. Okay, so the treatment changes depending on how quickly you get help. And is each symptom, is it a singular symptom we need to watch out for, or is it a combination of symptoms?
We could have one symptom or combination of the symptoms, but any of those symptoms should alert us that we should act fast, call 911, go to the closest hospital, and then the patient will be assessed over there. And if there's a suspicion that there is a large vessel which is blocked in the brain, then the patient will be transferred to a comprehensive stroke center where an urgent and emergency procedure is being done to open the artery to restore the blood flow to the brain. Because time is brain. As we wait, more and more cells in the brain will die. So for every minute that we wait, about 2 million cells in the brain will die.
Wow.
So you add the math, you have to act fast because if you're late, it's late to intervention, and then the functional recovery become less and less.
So let's say we are at the point where someone needs the surgery. You are a brain surgeon, but the methods of doing it nowadays are wild. You can go in through an artery.
Absolutely. So when we suspect a large vessel occlusion, meaning that an artery that's being blocked completely or partially, and the patient presents with signs and symptoms of a stroke, then the patient is being transferred to a comprehensive stroke center where there's the infrastructure and the personnel and the doctor and the intensive care unit and the technology to perform such a procedure, something we call a thrombectomy, which means that we go inside the artery under X-ray, usually from the wrist or from the groin. We navigate the catheter all the way inside the blood vessels of the brain, and we pretty much extract the clot. We remove the clot, take it out of the body, we restore the blood flow to the brain, and then the functionality will recover immediately, usually, if we act fast.
And I'm guessing with all of your expertise and sort of all the technology available, that's why it's important to go to a certified comprehensive stroke center.
Right, absolutely. So this is the highest level of care that a stroke patient should go to. So at UI Health, we are a comprehensive stroke center. We're the very few comprehensive stroke centers in the Chicago metro area. The comprehensive stroke certification is designation by the JERCO Commission, which is the highest level for stroke care. And that requires that you need to have the stroke doctors, the neurosurgeons, the guys who do the thrombectomy procedure, the neurointensive care unit, the personnel, but also more importantly, the research, the innovation, the quality that you do. You ensure that you are actually benchmarking yourself compared to national measures. So that is all essential. When you have all of that thing together, then the outcome that the patient will receive will be the best.
Dr. Ali, you are lovely, but I hope to never be on your table in an operating room. How can I prevent a stroke?
Well, stroke is preventable if we control the risk factors that leads to stroke. So what are the risk factors for stroke? Like any other cardiovascular disease, things like poor control, high blood pressure, diabetes, smoking, high cholesterol, sedentary lifestyle, not being active, all of those things can increase the risk of having a stroke. So the most important thing is that we need to work on our risk factors. If we do not work on our risk factors, there's still hope. And we need to identify the signs and symptoms that could be early warning. Do not miss on those things, because the early warning signs and symptoms, like transient vision loss or facial paralysis, transient, and then goes away, that could be the alarming sign that tells you that the storm that's going to be hitting next. So intervene before that happens. And do all the screening that you need to do. If you suspect that, we have non-invasive measures available for us. We can do special MRIs, look at the blood vessels of the brain. The technology, the innovation is just out there, and it's all available for our patients to get to.
So much great information. Thank you so much. If you need more information, you can head to stroke.uihealth.care. Scan that QR code to learn more about expert stroke care at UI Health. Thanks so much for being here.
Thank you for having me.